am in the new Iora primary care facility in Tucson discussing the future of medical science with Rushika Fernandopulle, who has brought us a new way to deliver healthcare in Tucson. Can you tell us how you created this model, Rushika?
Sure. So I'm a primary care doctor, and I think we've had amazing scientific advances over the last 50 or 60 years, but the way we actually deliver it to people is awful. It's depersonalizing, the outcomes are embarrassing, it's ludicrously expensive. And I think from someone working in the system, it's awful. I had a colleague once put it to me really well, is every day I lose a little piece of my soul. And I felt that way. I went into this, went through all this training to try and help people. And the system of 7-minute visits and these awful electronic health records and check boxes and wasn't allowing me to do it. And I'd spent a bunch of my career doing what most people are doing, which is what I'd call the incremental change model, is maybe we can take existing practices and tweak them a little. We make a few little changes and somehow that'll lead to something better. And I think the realization that hit me about 12 years ago was that maybe that wouldn't work, and that what we ought to do is start over. In any other industry, I think if the existing model didn't work, someone would be brave enough to say, let's just start over. And so why not do that in healthcare? And I think at root, what I realize is that we have built this system on a series of transactions. It's all about documenting, coding, and billing, widgets offline, and all the things we do to fix healthcare. You may have heard of medical homes or ACOs or meaningful use. They're all add just more checkboxes and transactions. And it wasn't clear to me that would get us where we want. So what we need to do is actually get rid of the transactions and recenter the system on relationships. Because I think that the only thing that's ever healed anyone is relationship and not transactions. So we have to get them out of the way so we can refocus it. So that's really what motivated me to try and build a new model.
Well, we are excited because Medicare patients are now going to get to come to this facility and experience a new kind of offering. So you're going to have not just the doctor, but other kinds of activities and events happening at this practice. Can you give us an idea of what's on store?
Sure. So our job now, we think, is not just do a series of visits for the doctor. Our job is that we have a population of people who sign up to say they want to get their primary care from us. And our job is how do we improve their health and keep them out of trouble? And you realize that's about this continuous relationship. So several things. So number one is it's not about the doctor. So of course, we're important. Our job is to make sure we know what's going on with you and we make the right prescription. But the hard part in medicine is how do you, the patient or the person, actually execute on that? And it's hard. If it was easy, it wouldn't be a problem. And so we, for every one of our patients come in, we make a plan, a shared care plan, where we get to agree on what we need to work on. And then we give you a personal health coach who's someone from the community, speaks your language, is picked because of empathy, connecting to another human being, who can work with you to try and learn about your condition and figure out what you need to track and what you need to do and hold your hand when that's the right thing to do, or to be honest, give you a little kick in the behind when that's the right thing to do. Maybe it's taking you shopping. Maybe it's actually teaching you how to ride the bus so you can get into, maybe it is to show you some exercises you can do. Maybe it's to work on mental health issues, right? So we have 3 or 4 of those folks per doctor, a lot of them, and who you have time to work with. We also mental health folks in the practice, social workers, because so much of the barriers for folks often doing the right thing is a little depression or anxiety or other sorts of things that we can help with. So we start each day in our practice with a huddle, where the whole team gets together, sitting around a table, and we talk about our patients. And we don't talk about the people coming in, because they're coming in, we'll figure that out. We talk about the people who are not coming in, right? So which of our patients are not coming in today, but we're worried about them? And then what can we do to help them? So whether it's reaching out and calling them or going to their house or calling their sister or whatever, people can obviously come in to see us and we're happy to meet people. And we want to meet you at least once in person because it changes the nature of the relationship. And but after that, we'll interact with you however you want to. So when you schedule an interaction, we ask you, would you like this to be a visit, a video chat, or a telephone call? And we're sort of indifferent. And by the way, you don't have to call us if you can go online and have that wherewithal, you just go look at our schedule, find a spot, take a spot, and then ask you, would you like to be in person, video, or phone, and just do it, right? Try and make it easy for you. When you come in, you meet your health coach and your doc together. In our rooms, we simply we work off our little MacBook Airs. We plug it in, so you get to see your chart, you see everything we're doing. It's not a secret. By the way, at home, you or your family can log in and see what we've done. See all of your notes, your chart last I checked. See the data, see the lab values. By the way, you see your lab values the same time we do. The whole idea is don't hide the ball. This is getting patients involved. We like I said, we will also happily do so by email. We'll come to your house if that's the right thing to do. We'll take you shopping sometimes if that's the right thing to do. When you end up needing a specialist, we have a small group of specialists and hospitalists that we try and use the data, and then we go and meet with, say we can work well together. So often we don't need to go see the cardiologist. We can help you take care of it with a little bit of their help. When you're in the hospital, we'll come visit you there. Even though we work with a group of hospitalists who manage the day-to-day, but we're involved in the care because we're your advocate. So this is not a little different than a typical practice. This is completely different.
I can tell. And I'm getting very excited because in 2 months, I'm going to be a patient here.
Good. We would love to have you. Our patients really feel well taken care of. And that's the point. I think the thing that differentiates us, though, is actually none of the stuff I talked about. So it's not our process, and it's not, we have a new technology platform we use to do this all. These electronic health records you hear about are not surprisingly built for the old system, documenting, coding, and billing. They're fancy cash registers, so we built our own. And that the folks there, we have a tech team that work for us and only us, so we can change it whenever we want to. We have different payment models. We don't get paid per sick visit. We don't have to code and bill or any of that. So we can sort of not worry about it. I think the thing that's really different is the culture. That the culture you feel when you walk in and you meet the folks we hire, and the way you feel treated, but it's also the way that we treat each other really makes it very different.
I've been to the Zappos headquarters, and that had this feeling instantly when I walked in. Even though the place was full of the party goers and everything, the people on the staff are really together.
Yeah, so not surprisingly, you may sense a little the Zappos culture with us. So Tony Shea, the CEO of Zappos, is one of our investors. And we have a practice in Las Vegas where we work with Tony and the folks at Zappos, the downtown project called Turntable Health. So
I saw that.
It's not by coincidence.
No, I saw that matchup, and I thought it was perfectly natural.
Yeah, we drink less heavily than they do.
That's good. That's really a good idea, because vodka is not necessarily the most healthy thing. But doing more with less, you're definitely doing more with less. So it's a very exciting time for Tucson, and I wish you luck wherever you decide. Oh, by the way, why did you pick Arizona? Is it the law? Is it the legal structure that made Arizona the...
So we are a young company. We're 5 years old. We started in Boston, which is where I live. And then as we've now grown, our mission is try and transform healthcare. And let's do it everywhere, but let's find places where we think this works. And about 2 years ago, we started to go into working with seniors because we think there's a real need to create better care for seniors whose care is probably more fragmented, reactive, and et cetera than other people. This model works really well. I think we're looking for places where there are obviously lots of seniors, which there are many of in Arizona. I think places where we feel like the folks are open to new ways of doing things, right? I think compared to some places, for instance, on the East Coast, where people are much more same old conservative. I think places like here, we work in Nevada, we work in the state of Washington, where people, I think, are more open to let's try new things. Particularly, I think we do a lot with sort of integrative medicine, and where we involve acupuncture and some Reiki and other sort of healing modalities, because we think Western medicine is really good at some things. Get a pneumonia, antibiotics work well. There are other things Western medicine is probably not as good at, and we ought to be open to using other sort of things for those. So I think Arizona is a great place for that. And then finally, I think you mentioned the regulatory environment here is much easier, where, when we're sort of doing things that are a little outside of what the normal folks do, it's easier, less hoops to jump through.
Right. Right.
So we opened 2 practices in Phoenix last year, and they've been very successful. And we're opening a 3rd one there this year as well, and we're opening 2 here in Tucson.
So, in a way, you do have to give Andy Weil a little thanks for creating the groundwork.
Oh, absolutely. We stand on a lot of people's shoulders, and he's certainly one of them.
Well, and he made this town different. It really did change under that whole influence. I remember when he first started up, it was a different place.
Yeah, and then the other thing we found is there are lots of great docs in the area, local, who get it and who want to work in this sort of a setting. So that's another reason why. So when we look for where we want to go, is where can we find a good supply of docs or local.
I think you found a great one in Julie, and I look forward to working with her too.
Right.
So I really appreciate you taking the time, Rushika. I'm sure that the listeners and everyone who gets to come here is going to be very pleased with the outcome. Thanks a lot.
Great. Thank you.